I'm Frederik Steyn. I'm from the University of Queensland in Australia, and we do work with people with MND. We started a study about 4 or 5 years ago looking at factors that can modify the progression of a patient, and one of the stories that was emerging at the time was this idea of an alteration in energy use in our patient population. So we started looking very carefully at energy use in the patients, and we found that about 40% of our participants were hypermetabolic. So their bodies were using a lot more energy than they should be. And the question was whether this is going to have an impact on their progression, but also their capacity to maintain their body weight. And we actually found that while hypermetabolism had a big impact on survival, it didn't modify the capacity of the patient to maintain their body weight. So it wasn't key to why some people were losing weight and why weight was such a negative thing for their progression and their survival. And also it meant that we couldn't really intervene to help them maintain their body weight. Now the other side of the equation, of course, was appetite and how people feel about food. Now the problem is that most of our studies really focus on the symptoms in the throat and swallowing and the bulbar symptoms, and we have this misconception that bulbar symptoms are the only factors that modify the capacity of the person with MND to actually eat and maintain their calorie intake. And really, when we started looking very closely, we found that a lot of people were losing their appetite without actually having any real presentation of bulbar symptoms, and that in some cases loss of appetite happened very early on, even before they were diagnosed with MND. And so we've designed an entire project around the idea that appetite loss in MND is very common. It has a big impact on the individual, but also the family and the members that care for them. And that it's something we can easily modify to potentially slow down the progression of MND. I don't think that patients should be worried about loss of appetite. It doesn't help them. But they should be mindful about losing their appetite. And if they do lose their appetite, they should consult a dietitian very early on to put in place strategies to help them maintain a healthy appetite, because if you feed your body, you can resist the progression of the disease. And there's a lot of studies to actually show that's very true. So when we first started doing the study, we of course looked at the literature to see what people should be eating with MND. And we were very disappointed to find that very few studies were actually looking at that. There's some studies where they did questionnaires to see what people were eating in the years leading up to MND to show that particular foods can increase your risk or decrease your risk for MND. And there were some studies showing that certain foods can actually slow the progression of MND, but none of them were actually looking at what people were eating at that time. One of the studies is a Cosmos study, a very nice study, looked at oxidative and antioxidative foods. So these are foods that can actually help the body cope with the effects of the disease. And they found that some oxidative foods, vegetables, green leafy vegetables, color in your diet, lots of healthy fruits, and even some meats could slow down progression, or at least were associated with a correlation that would suggest that it slows down the progression. But unfortunately, nothing really concrete to tell us what people should be eating. So we're doing that now. We are looking at what people are eating as they come in for research visits and how that might have an impact on the progression. And the idea is that by the end of the study, we can put in some guidelines to suggest that people should be eating particular kinds of foods if they want to slow down, or if they can slow down the progression of their disease. So we haven't found a single common factor that can actually suggest this person's going to lose their appetite. And I think that's because appetite is a very complex and very comprehensive area of research, and it involves things like your ability to access food. So if you have MND and your hands are getting weaker, you're less likely to go make yourself a snack or a meal, which means that you have an increased dependency on whoever is helping you throughout the day. That in itself puts more burden on the person looking after you, so therefore as a person with MND, you may be less likely to ask for help. But also bringing the food to your mouth might be a big problem, and therefore you're less likely to eat without assistance. A lot of people with MND find that the social act of eating, because eating is a very social event, is suffering, and so their pleasure towards having a social and communal meal decreases, and therefore they're less likely to go out and have those big meals together with friends. And then of course there are the physiological changes. We have evidence to suggest that the factors that are released by your stomach and talk to the brain to suggest that you should be eating are impacted by MND. But also at the same time we suspect that some areas in the brain that control your desire for food are also affected. So there's no single factor. It's about identifying the loss of appetite and then trying different things to help people meet their energy needs. And I think the alarm comes when they go into the scales and they find over the last 2 months they've lost another 3 or 4 kilograms. And what we try and do is remind them they don't need to be alarmed because they've identified the problem. Go see your dietitian and ask your dietitian to put in place an effective strategy that can help you actually meet your energy needs.